Good morning, and thank you for tuning in today. My name is Janet Calderwood. I'm a registered dietitian, and you are watching The Dietitian on a Mission. And if you watch this show regularly, I want to thank you for your support, for watching. You know, our goal is to always help consumers separate nutrition, fact from fiction. That can be a very daunting task. And also, to help you use this information to live better. I appreciate your support, and I bring people that I feel can help us to get the right answers. And today, a very special guest of mine, somebody that you've seen that's here quite a bit, Dr. Mary Lewis, is the one I always like to throw the tough questions at and get the real. She's out there working in the front line in healthcare, and she can really help us understand, you know, more about why people do things, and really certainly what is the science behind it and why shouldn't they do things. So if it's going to help us make better choices, I think it's worth hearing. So thank you for being with us today.
Oh, my pleasure, Janet. I'm happy to be here.
And we're calling this show, it's called really Health Myths, True versus False.
So we're busting the myths.
We're busting the myths, or, you know, I might ask you some specific questions about things that need more clarification, because, again, if depending on who you ask, you get 10 different answers, and we know that anytime people are ingesting medicine or whatever, they should have the right information.
Well, it can be very dangerous to assume something.
Making assumptions that none of us want to do.
Well, there's so many things that our mothers and grandmothers or whatever have ideas that have come down through the years. Like one thing is feed a cold, starve a fever. What are you supposed to do? Feed a fever, starve a cold, or feed a cold and starve a fever? I mean, there's the stories for all of that.
Okay, so let's talk about that. Feed a cold, starve a fever.
So
what should you do?
When you have a fever, your metabolism is increased, so should you starve yourself then? Of course not. You need more fluid and more food at that time when your metabolism is higher. So feeding a fever makes sense, and feeding a cold also. You definitely need more nutrition and more fluid if you have a cold to keep everything moist and help the cold go away. So never starve a cold or a fever.
All right,
when
now
you think
I have
about logic.
a question. Now we know that sometimes when you have a fever, there's other symptoms that are going along with that, right? Fever, usually your body's fighting off some kind of infection.
Exactly.
Right? And so in addition to not starving either way, taking a fever reducer can help, right?
Yes. So something like aspirin, ibuprofen, Tylenol, those seem like very safe medications to use.
What if the fever's not going down? Like, when should somebody intervene here?
So an elderly person, like somebody that's over 65 that has a fever over 100, that's kind of important. And if it doesn't go down with some kind of antipyretic like aspirin, ibuprofen, or Tylenol, that's kind of a scary thing, because an older body does not respond, it cannot respond, doesn't have the immune response to lower fever. And so if they get a fever, it's because it's really, really bad. So a baby, on the other hand, under 2 years old, generally responds very quickly. Any little thing, their body responds very quickly. So then the child and adult are kind of in between there. So an adult who has a fever over 100, 101, that's kind of serious. If it doesn't go down, they should see their physician or call their provider.
So if it doesn't go down, in what period of time are we talking? Like
in 4 hours, 6 hours after taking medications.
Should you ever lay in a bathtub with ice water?
There's nothing wrong with that. Keeping yourself
It's
cool.
cold. You're going to put yourself in shock.
Yeah, and there's the theory that if you make somebody with a high fever cold, their body's going to work harder to warm them up even more. So there is that theory.
Well, then I've also heard that if you, it sounds counterintuitive, but I've heard that if you have a fever and you lay in a warm bath, that sweating will actually help cool you down.
To break the fever.
Yeah.
Yeah.
So,
and so Not sure. I mean, in the hospital right now, we're not putting blankets on people that have fevers. We try to cool them down. So maybe not so extreme either way, but
Okay.
don't.
But don't starve yourself, okay? That's the bottom line.
And you know
Stay
that
hydrated.
the chicken soup thing?
The chicken
Very
soup thing.
good for fevers, for colds. It's moist, it's salty, it's fluid, and it helps everything.
It helps everything. Chicken soup.
So that's still okay.
Good. I'm glad to hear that. Now, what about milk? You know, sometimes people say you have to avoid milk, right? It's going to cause all this extra phlegm, but I haven't found anything that can really substantiate that claim. Have you?
You know, the thicker milk, like the whole milk, may, because it can actually, the fat in there can actually make the mucus seem a little thicker. And things like yogurt's like a thick milk. That can do it too.
Okay.
So in small amounts, make it thin before you try to swallow. So milk shouldn't be avoided completely. Milk, there's a lot of great benefits to milk.
So low-fat varieties would be better. Really, nobody over age 2 needs whole milk anyway.
Yeah.
So I wouldn't expect that you're drinking whole milk unless you're watching the show and you're 2 years old. So that
or
would be okay.
need to gain weight, have an
need
issue
to gain weight. But if you do, I think you mentioned to me in the past that if a person has a problem with that and they find that it's causing a lot of congestion, then just to avoid it.
Just avoid it for that time and switch to water.
Okay. Yep. But she did mention that milk does have a lot of key nutrients. So it has a lot of protein, calcium, important for bone health and different things like that. All right. What about aspirin? I mean, aspirin is something everybody's heard of, but what is it the best medicine, really?
You know, that's the old thing. Aspirin is the best medicine. Take 2 aspirin and call me in the morning. You know, aspirin's wonderful.
No, it's an apple a day. It keeps the doctor away.
Right, but not the nurse practitioner.
Yeah, okay.
But aspirin. Aspirin's a great medicine. There's so many uses for aspirin. It's an anticoagulant, so it can prevent strokes and heart attacks, keep the blood thin.
So it kind of acts like Coumadin.
Yeah, that's right. Some people are weaned from Coumadin or Xarelto or some of those to aspirin.
Okay.
And if those are too strong, people are advised to take aspirin in different strengths, either baby aspirin at 81 milligrams or big aspirin, adult aspirin at 325. So it's used as an anticoagulant. It's used for fevers.
Okay.
It's used for arthritis.
Wow.
So it reduces arthritis. An aspirin a day can help reduce the risk of colon cancer.
Really?
There's so many
now,
things that
an aspirin a day in the 81 milligram strength?
Yes.
And is that buffered or non-buffered?
Well, if you take an aspirin that's non-buffered, then you have a higher risk of bleeding ulcers.
Okay, so you would always want to take a buffered aspirin?
Always take the buffered aspirin on a daily basis.
Okay.
The only time you wouldn't take a buffered aspirin, well, there's a few times. Some people want to dissolve aspirin in water and gargle it for a sore throat. That's fine. That's what those good old fuzzy aspirin, weight aspirins are good for.
Okay.
Also, if you think someone is having a heart attack, let's say that they're having chest pain, you're running around the house worried about that person, you don't know what to do. If you have some white fuzzy bufferin, Bayer aspirin, give them 1 or give them 2. Let them dissolve in their mouth or swallow them down. That's
so
okay.
Not the buffered ones.
Not the buffered. They'll help reduce, if there's a heart attack or angina going on, they'll help anticoagulate in an hour and a half. Whereas the white fuzzy one that's not buffered, it'll help immediately to help reduce that.
And do you recommend the 81 milligram strength when you're trying to, you know, while you're waiting for the EMS vehicle to come? Or
no, the 325.
325.
Big old fuzzy aspirin.
Big fuzzy one. Okay.
And you can do
Keep
1
some of
or
those
2.
handy. All right. 1 or 2? You
1
said?
or 2. You can
1
take
or 2, your choice.
Yes.
2 for the price of 1. How about that? Okay.
It's a great idea.
All right. So aspirin, and then you mentioned this thing about they reduce your risk for colon cancer.
Yes, even colon cancer. There's so many good things about aspirin. That's one research that study that has come out over and over again, repeated, that you have a lower risk for colon cancer. I think it possibly has to do with the anti-inflammatory property of the aspirin. So it reduces the inflammation in the colon, so we'd have less risk for polyps or other growths in the colon if we're not as inflamed.
So these aspirin in these pretty small amounts, I would say, they're not liver toxic or anything. Their prolonged use isn't going to do anything damaging to that we know of to our internal organs or anything.
No, there's really no risk factors to it. It is metabolized through the kidneys also, but it's really haven't been any real risks except bleeding. So if it, if people get older, their skin gets thinner, and if they find that they're having a lot of bruising in the dark spots, or if they have blood in their urine or something like that, then they really need to talk to their provider about taking the aspirin. And some people do end up taking aspirin therapeutically for anticoagulation, prevention of strokes, just 1 day a week or 2 days a week if they need to.
Okay, good. I mean, I'm not telling people to switch from vitamin C tablets to aspirin, but hey,
But we always talk about the medicines, and we always talk about the beneficial side effects of medicines that are actually poisons to our body. And when you think about aspirin and what else you're taking, if you mentioned vitamin C, I automatically started thinking about glucosamine and the aspirin and anticoagulant effects of glucosamine chondroitin that people take for arthritis, and then fish oil, combine it with alcohol, you're increasing your risk for bleeding. So make sure when you talk to your provider about aspirin, you are clear about all of those supplements and other
I
medicines.
agree, and my goal for patients that I counsel is try to obtain your key nutrients from your food options. I mean, for example, why take a vitamin C tablet when you can actually eat an orange, or something like that that's really, like red peppers have a great deal of vitamin C. It would be better for you to get those key nutrients from your food sources rather than supplementing with something from a health food store or something. And that brings up another point. I mean, oftentimes people feel that if something is natural, for example, that it must be safe, right?
Like a pill that's natural, like full of natural vitamin C.
Like aloe vera is natural.
Yeah, but what could be more natural vitamin C source than an orange?
Right.
Why would you go to a pill? And aloe vera is another good
topic. The reason I bring up aloe vera is because a lot of people drink this, right? People, and we know now that aloe vera can contain carcinogenic properties, that they did find tumor growth in rodents. And so I say that, something as innocuous as aloe vera, but again, I mean, we just need to be mindful that just because something is natural doesn't necessarily mean it's not harmful to us, especially with prolonged use. And sometimes people just get carried away with things and they think if a little is good, okay, well, I'll drink a gallon of aloe vera juice.
More is not better in anything that you put into your body. It's not more is better. But there are beneficial effects to aloe vera. People are taking it for acid reflux. You just wonder what the long-term effects of that are, and should you depend on that every single day? And that's something, do some research on and for yourself, and ask your provider for other options that may be helpful in that case.
Right, okay, and a good website to go to is, there's a government-sponsored website. It's the Office of Dietary Supplements. I didn't give our wonderful production manager the web address, but if you just Google Office of Dietary Supplements, and you will find a nice rundown of a lot of popular supplements and the pros versus the cons of taking something like that. So you could do that. All right, shifting gears a little bit. Now, we have heard this historically for years that everybody needs 8 glasses of water a day.
Right, 8 ounces of water every day.
That's what you need to get your hydration needs met.
Okay, so where do you get your water from? So let's say that you make smoothies for breakfast and you put milk or water or juice in there. Okay, and let's say you're taking about 30 ounces of that. That's a lot already. That's water.
Yeah.
That's water. So you've got to count that.
The chicken soup you were talking about.
Yeah, that's water.
That counts as fluid.
Yeah.
Fruits and vegetables provide approximately 25% of your fluid needs in your diet. That counts. So these are actual, it's more, instead of saying 8 glasses of water a day, there's other ways we can tell whether an individual is adequately hydrated, correct?
Yes, I
What
mean,
would those
look
involve?
at the dry mouth and the dry skin, and too much water can give a person dizziness, drowsiness, headaches, and you can have water intoxication where your sodium level goes down because you have so much salt. Some people will restrict their sodium.
Wait, their sodium level can go down because they have so much fluid on board, correct?
That's right, and they cut down their salt in their diet thinking they're doing a good job. They drink lots of water thinking they're doing a good job. That's it. You think about a cup of water and put some salt in there, you put too much water, your salt goes down. And what happens is the brain absorbs all that water. That's the job of the brain, to absorb the water. And if there's not enough salt to keep it at level, the brain is going to absorb it, and that's what you can die from, actually.
So one thing you can do is you can do what I call a urine check. You can check your urine. The color of the urine, you know, aside from people that have certain chronic conditions like liver disease and things, but typically the color of the urine should be a very pale, straw-colored, correct?
Yes, that's what we're saying.
And that could be used to help guide you in determining how many fluids a person needs. It's usually, you know, I think 8 cups of fluid a day is a good average. You know, you could use that as a guide, but again, depending on how much you're outdoors and how much you're sweating and how much you're exercising and all of these factors that can certainly play into what your fluid needs are, and medical conditions where you have to limit some of those fluids when you have congestive heart failure and things like that. But usually looking at the color of your urine and making it such that it's straw colored as the goal would be something worth mentioning.
Yeah, if you are somebody that is an athlete, you ride bike outside, or you run, or you walk a lot, and you sweat a lot, you work outside, you know, water's good. You need to replace the water, but then you also need to balance it out with like Gatorade or some other
that have some electrolytes. Okay.
Source.
Okay, very good. But not all the time. You don't need to just always drink Gatorade all the time. You could like alternate maybe a water and a Gatorade.
Oh yeah,
or
you
something.
shouldn't do straight Gatorade, you shouldn't do straight water. So
Or diluted. Okay. So that's good. Now, you know, eggs have for years been vilified as the enemy to cholesterol, and yet recently we know that things have changed, haven't they?
yeah,
With
eggs
egg
actually have
recommendations.
some beneficial side effects to eggs. You know, for a while it was eat the yolk, eat the
white.
eat the white, throw away the yolk. And
Yeah.
now we're finding out really there's some great proteins. And
What about one of the few sources of vitamin D in the egg yolk?
yeah, well, we have a huge problem with vitamin D absorption. We found in the United States that many people are low on vitamin D, which increases their risk for low calcium absorption, which means they're at risk for fractures
And falls and everything.
and falls. So
Yeah.
so vitamin D, we're looking for sources of vitamin D.
And it's not easy to find natural sources occurring in the diet.
So the egg is a great source for that. So the American Heart is recommending a couple of eggs a week. It's okay.
And actually they're even saying, you know, what we know even a little bit further along the lines is that serum cholesterol levels are not dictated by dietary cholesterol sources, and we know that of course eggs have a significant amount of cholesterol in them, but the health benefit of eating an egg with all that high biological value protein, and then those key nutrients like the choline and certainly the vitamin D and other things that are just very valuable to the diet, would be more beneficial. I would say that, you know, even if your cholesterol is normal and you're not having problems with that, then, you know, eat an egg or two a day. Unless you're following a real strict heart-healthy diet and cholesterol still is a concern and you have elevated cholesterol levels, your physician or your cardiologist may want you to just be real mindful that, hey, you know, that's still a significant source of dietary cholesterol. But they have really relaxed the standards, and we aren't saying avoid them at all costs like they used to.
Yeah, and it's okay to eat the white either way.
Yeah, the egg whites, I think an egg white has 21 calories. I mean, and you can have an egg white. I love egg whites.
No fat.
No fat. And sometimes what I'll do is I'll have an omelet with just maybe one regular egg and then the rest the whites.
Yep.
So,
yeah,
so if you like eggs, they're still incredible and edible, but you know, with anything, moderation is always the key, right? And you know, eggs are a great low inexpensive way to get high biological value protein.
Yes.
It is the gold standard for
70
protein.
or 80 calories with a whole lot of protein and
Easy
nutrition in
and
'em.
versatile, you know. You
Yep.
can have them for any meal,
Yep.
right? There's so
Yeah.
much to do with them.
Yeah.
All right, now, let's see. Carrots help you see better in the dark. Is that true or
mean,
is that false?
That's what I was told when I was a child by my parents. Are my
you
parents
better
wrong?
eat your carrots.
Eat your
right?
carrots, yeah. I think my mother liked carrots, and so she probably said that. I don't know.
Yeah,
I don't
she
know.
liked the color.
Yeah,
Color
well,
of the
they're a
jacket.
great source of vitamin A, which is good for your vision, is good
Right.
for eye health. But you can overdose on vitamin A.
And vitamin A is a fat-soluble vitamin, so it does store in your body.
It's stored in your body, so if you have too much of it, actually some of the research is showing that too much vitamin A over a long period of time can make you at higher risk for lung cancer, which is our #1 cancer. So staying away from
Interesting.
too much vitamin A is important. We just finished Thanksgiving, and the yams and the sweet potatoes also are a high source of vitamin A. So if you love that and you love carrots, just think about it. You might
Yeah,
wanna-
well, you don't need to be taking a supplement that's got 5,000 times your daily value for vitamin A. Just get them from your food sources.
Exactly, and that's enough.
And usually the orange vegetables are high in beta carotene. So most people aren't going to overdo it if they're getting it from their food sources, believe me, unless you're eating carrots all day long and your skin is turning orange. That would be an indication if you start looking like the carrot top.
Then
right?
you might want to drink some more water.
Yeah,
Wash it
drink
out.
some water, right? But I think moderation is the key here. I mean, people just need to remember to vary their vegetables. All the colors of the rainbow is a good source of key nutrients, and if you're eating different colors, you're getting a lot of different antioxidants and phytonutrients that you wouldn't get from the other. So eat the rainbow, and then you're safe.
And it looks pretty on
It
your
looks
plate.
pretty, yeah, and it
Different
tastes
colors.
good. Okay. What about, is this true or is this false? I'm trying to stump her, see if I can get her. Can you get tetanus from being cut? You can get tetanus from being cut by rusty objects? Is
Yeah,
that
what
true
about
or
a
false?
clean object too? Definitely from rusty objects.
Uh-huh.
Now, you think about the surface of a clean nail. It's smooth and shiny.
Yes.
Okay, it's still got germs on it, but it's smooth and shiny. But now when it gets rusty, it has a lot of different surface areas on it because it's bumpy and it's got ridges. All kinds of germs can grow in a rusty surface. So
Okay.
you're at much higher risk for getting tetanus from a rusty nail, although you can still get tetanus from a clean, shiny nail.
So the bottom line is if you step on a nail of rusty or shiny,
Any
you
nail.
should get a tetanus shot?
You should have a tetanus shot regularly. For children, it's every 5 to 10 years, and for adults, it's generally every 10 years. But if you're somebody who's at risk for that, and you tend to step on nails or grab nails or something like that.
If you're a nail grabber.
If you're a nail grabber, then maybe
by all means.
you tend to get cut pretty often from wood and nails and things like that, then probably every 5 years.
Okay, now is this true or false? Cracking your knuckles causes arthritis.
Isn't that cool? I think it's neat to talk about it. Some people do that as a habit, and
I know
drives
people that do that.
other people nuts.
Oh,
and
tell me about
the
it.
thing is, does that cause arthritis? Well, the thing in all of your joints, you have synovial fluid in there, and there's lactose that's built up in there too.
Okay.
And it can bubble up. If you are very still, you don't move your joints around too much, you can get like thickened lactose and synovial fluid in there. And you pop your nails, some of that gas will actually come out of there, and it feels better. It just feels good to
It
have
makes
that
a lot of
moved around
noise.
and get that air out of there. But does it cause arthritis? No.
Oh, it doesn't cause
No.
arthritis.
But it does
Okay.
feel good.
Does feel good. Now, is walking still the best exercise, or is that just
It's
we believe
an
that to be
aerobic
true?
exercise, and it's good for people if they can do it. There are people with bad ankles, bad backs, bad knees and hips, and they can't do it. For them, it's not a good exercise. And
Maybe swimming would be better.
and they'd be, yes, and some people can say, well, I have a bad knee. I'm doomed now because I can't exercise. There's always something else that they can do, and they should really look around for whether they have access to a pool to do that. Biking,
Ask their physical therapist. They
and,
probably
yeah,
help come
yeah.
up with some suggestions.
Zumba classes. But the idea with exercise is to get your heart rate up to your
Target heart
target
range.
level, yep, and then keep it there for 20 minutes or so every day. Whether you're doing it by mopping the floor, walking the dog.
It will never happen by mopping the floor. Believe me, that's not going to happen, I'm telling
Yard work, mowing the lawn, whatever you do.
you. Yeah, whatever you do.
Whatever some people do.
Yeah, whatever some people do. Okay, so exercise, whatever a person will do is going to be good for them as long as it's not causing any added strain and discomfort.
Yeah.
Because the last thing we want is them to experience an injury.
Right, exactly. And
Okay.
walking is pretty safe as far as that goes. People who run generally think that running is the best exercise, and boy, it feels good to run. I mean, you feel like you're accomplishing something when you run, and look what I did, and your heart rate's up. But actually, walking 2 miles is equal to running 2 miles as far as the benefit for your heart.
Okay, good. And then, you know, we always have these great discussions and we don't get through half of the things that we want to talk about. But I do want to talk about one last thing before we end the show. And that's, you know, people say all the time, hey, you know, the best way for me to avoid salt is not to use the salt shaker. What
Yeah.
is your thought on that?
Well, look at all the sources of salt.
Right?
You know, like not using the salt shaker at the table, that's
Yeah.
a great idea. But there's probably still salt that's been used in cooking.
Oh yeah, well, and there's so much sodium in processed foods. In fact, if you think about it, when people tell me, oh yeah, I've been doing what you said, I know I'm not allowed to have a lot of sodium because I have high blood pressure and everything, and I'm not using the salt shaker, and then I find out they've had a piece of whole grain toast, they've had skim milk, they've had maybe some bran flakes for cereal, and I'm like adding this up for them, and they've already got 650 milligrams of sodium. They didn't even use the salt shaker, so that can't be true at all. That's false, and that is, you really need to pay attention to the labels. You need to look and see what is the sodium content found in the food and go by that. It's usually not the salt shaker that's contributing the greatest amount of salt to your diet. It's the processed foods. You're always such a delight to have on the show because you have so much information about so many different things that helps people live better. And I want to thank you for being here today. Want to thank you for tuning in. Hope you learned something new and you were taking notes. Look forward to seeing you right here next week on CTN 10.